When I was younger in my career, and patients would tell me things like, oh, my pain gets worse when I sit under the air conditioning. That had made no sense to me whatsoever. It didn't fit in my training, which was a very biomedical baseline training, right? And I'm like, they're making this up. This has nothing to do with anything. What in the world is going on? And yet, time and time again, the patients told me the same thing. Like, there must be something to this. What am I missing, right? And so I really started to dig in. And what I was finding through all this extra training I was doing is that really the patients know what's going on. They understand what seems to cause the problems. They just use terms that we don't understand, which is kind of funny, right? Because we often think about our medical terminology and medical jargon and avoiding that because they don't understand it. But I realized we were approaching the conversation almost speaking two different languages. So they had their descriptors, but we didn't have that foundational pain science knowledge to understand what their descriptors were telling me. So those patients that had pain under the air conditioner were just telling me about allodynia, right? And so now we have that understanding of what that means. But it took me a long time to recognize how much that if we sat there and really listened and dug in, that we could really understand our patients from there. So the clinical conversation, even with all my like extra training in manual therapy and some of these like dry needling and some of these other like typical interventions that we think about with our hands, I've really come to value the clinical conversation, both as its ability to understand the patient, but as an intervention in and of itself.